So stem cells can play a vital role in ending or preventing chronic disease by lowering that chronic inflammation, by helping modulate and giving support to the immune system, by actually getting rid of or preventing scar tissue to happen not just on the outside of our bodies, but inside in our organs.
Welcome to Ending Chronic Disease, where we challenge everything you thought you knew about health. Join international best-selling author and wellness pioneer, Dr. Fabrizio Mancini, as he reveals how to transform your body, your mind, and your life starting today.
Hi, this is Dr. Fab Mancini, and I'm so excited because we're going to be talking today about stem cells. You know, this is a subject that it's been around for over 40 years or so, that people began to really understand what stem cells are. And ever since the beginning, I was very excited because it falls under a specialty or a realm of medicine called regenerative medicine. And stem cells is actually something that is a natural cell that can actually help us not only live longer, but also look younger. So I'm bringing to you one of the world's experts in stem cells, TR McManus. TR, it's so good to see you again. How are you?
Thank you, Doc. Thank you for having me. It's great to see you as well. Thank you again.
Well, you know, I was so excited because I know you've been in this space for a while, and I recently came to one of your clinics in Costa Rica where I had an amazing experience with over 200 million stem cells put into my body through an IV. And I'm telling you, this was my sixth experience doing stem cells, and by far the greatest and the best so far for many reasons. But for individuals that are hearing us or watching us right now, how would you explain what stem cells are and how do they naturally work in the body?
All right, well, great question. So stem cells are cells like the over 200 different types of cells we have in our body, but they have a unique superpower. So stem cells can duplicate themselves or clone themselves or make more of themselves, just like all the cells in our body. But when the body needs extra tissue, extra cells, or needs to repair, stem cells have the ability to also give rise to other types of cells that may be needed to fix the body, to repair the body, or to maintain the body. And that's an important function of what they can do. So they can actually be called into action. They kind of are like firefighters that wait at the firehouse, and when they get the bell goes off and they get the signal that there's a fire here or an accident here, they can be called into action and go to the different places that are necessary to help the body respond to the need and repair itself, or to fix itself, or to maintain itself.
Well, you know, you've been in this space for a while, and there are many different sources, or at least a few sources as to where do we get our stem cells from. But then through this evolution within your own self, when I went to Costa Rica, you have your own sourcing process, which you've developed based out of years of experience. So tell me a little bit, for those of the individuals that are listening, what are the different popular sources of stem cells, and why did you end up going to the umbilical cord as one of the main sources for your stem cells?
Well, great question again. So there's different types of stem cells, like you're saying, as well as there's different places you can get the stem cells that we work with. So we work with a type of stem cell called a mesenchymal stem cell, and some people say a mesenchymal stem cell. And we have these cells everywhere in our body. Anywhere where there's a lot of blood flow, even in our teeth, we have these cells. And these cells helped us develop our bodies. They helped us grow our bodies. Every time we had an accident, an injury, a bump, a bruise, a scrape, they helped fix our bodies. And they also help us maintain our bodies. So every day we're under this constant load. We lose around 60 billion cells every single day in our bodies, which is close to 700,000 cells per second. So these cells are part of which helps us grow, maintain, and fix ourselves. Sometimes people get them from their own body fat, so it's called an adipose harvest, and they pull them out of the person's body. Sometimes they get them from their bone marrow in their hip. It's called a bone marrow aspirate. The problem with those cells, and we used to work with those when we started this years and years and years ago in Colombia. So for us, that's what we started with. But what we found is as we get older, as we have disease, as we have more exposure to toxins, chemicals, pollutants in our environment, our cells also have those same exposures. And as we age, so do our cells, and they slow down. They become less robust. They don't have the powers that they had before. So what we found is if we're able to get cells from the umbilical cord, specifically the Wharton's jelly that wraps around the umbilical cord. So our umbilical cord has this gelatinous substance that wraps around it, protect it while we're in our mother's womb. And deep inside of that of the Wharton's jelly, there's something called the perivascular Wharton's jelly, and it's really, really rich in these mesenchymal stem cells. And these stem cells are young. They're coming from the birthing process. So healthy mother, healthy baby, and then we're able to take what was used to be thrown away, and we're able to use them for medical applications as well as scientific research. So these are these young source mesenchymal stem cells like we have everywhere in our body, but they haven't had the exposure to toxins. They're young, they're robust, they can duplicate or make more of themselves faster. They can give rise to tissues that our bodies need to repair itself faster than when we're older. So we have a process like in Costa Rica as well as in Colombia where we think it's important to know where the source of the stem cells come from. We want to see and meet the parents because that's where that comes from. So we actually meet all of the different donors who are going to donate this tissue from us. They actually come to our facility and our medical team meets with them. We run tests. We look into their history. We look into their family history. We make sure that they're healthy, they're young, and they don't have any transmutable diseases. Our obstetricians actually watch the entire process of the pregnancy and making sure that there's no problems at all that come up. So if there was a brief bout with high blood pressure, if there was a brief bout with diabetes or any kind of severe infection, then that would be a birth or a cord that we would not accept. Even if the baby comes a couple weeks earlier than expected, that would be a cord that we wouldn't accept. The other interesting thing that we do is our team actually goes to the birthing center and we collect the cord when the birth happens. So we're right there. So we have something called chain of custody. So we know that the cord was handled correctly and we have it in our possession. And we have something called cold chain. Cold chain basically means we know that the tissue is being properly handled from the birthing center or the hospital back to our laboratory. Once we get it back to our laboratory, we actually inspect it, we test it, we make sure there's no communicable diseases. And people ask us all the time, are you sure there'll be no infectious diseases or transmittable diseases? 100%. We would never allow a cord that was contaminated into the clean room that you saw, that you were actually inside of our lab. So once we know that happens, we have the source. We know it comes from a good mother, a healthy mother, healthy baby, healthy process. It's safe. Then it can enter into our lab where we can start our next step, our quality controls of doing all the testing that we need to do, doing all the sourcing and pulling the cells out of that umbilical cord so that we can actually have the ability to start the process of cultivation.
Well, when I saw everything that you were doing, that's the reason that I was so motivated to fly to Costa Rica. And I know you have an incredible clinic in Colombia, which I'll be coming in June.
Yes.
This is a very special process that I've seen more thoroughness in this than anything that I've seen over the last almost 35 years that I've seen stem cells come into the picture. Yeah. But let's talk a little bit about chronic disease. There are two statistics that really alarm me. Number one is that 90% of the healthcare costs in the United States is attributed to chronic diseases like cancer, heart disease, diabetes, arthritis, chronic pain, and others. But then there's another one that really alarmed me, and that is through the WHO released a study that showed that over 70% of the deaths worldwide are attributed to chronic disease. So how does stem cell help someone either prevent or potentially reverse their chronic disease?
See, and that's a vitally important question. And if we're really going to truly help mankind and people do better and be better, we have to confront the cause of chronic disease, right? So there's different things there's different doctors and scientists and people out there that go, well, it's because of aging we get chronic disease. Some people go, it's because of lifestyle that we get chronic disease. Some people go, it's because of stem cell exhaustion was one of the hallmarks of aging that we get chronic disease. And really, it's really all of them. So we have to have a really, really thorough approach on how we're going to address this. If you look, I remembered attending a lecture online with a Dr. Rob Signer on UCA San Diego, and he's an associate professor at UC San Diego, brilliant guy. And he said something that shocked me. He said that by the time people reach the age of 28, and I remember being 28 a long time ago, I wasn't worried about what he said. It was most people, their biggest risk in their health is age and age-related diseases. And that by the time we're already 28 years old, from a biological standpoint, we're really over the hill. So remember earlier I said that we lose around 60 billion cells a day, or around 700,000 cells per second. So by the time we reach 28, it's already hard for our body to put itself back together again. Now in biology, which we have biological bodies, form equals function, or how something is shaped is how well that it'll actually work. And you can look at a body at 20 and that same body at 40, that same body at 60 or at 80, and you'll notice that it changes shape. And you'll notice that it doesn't work at 80 like it did at 40 or at 20. And that's partly to do from the process of biologically changing form or changing shape. So as we start to have stem cell exhaustion, as we start to have more stem cell exhaustion as we age, we not only have to confront chronic disease, but we really have to go after the effects of aging. So what we do at Infinity, both in Costa Rica and Colombia, we want to look and go, well, what are the fundamental things that we have to address in every single patient to make sure that they get the best result possible? And one, of course, is inflammation, a chronic inflammation, right? Chronic inflammation is, like you said, the leading killer of mankind. Chronic inflammation accelerates aging, which accelerates chronic disease, causes more chronic disease, etc. So we want to make sure that we can do anything in our power to lower the chronic inflammation that happens in our body naturally as we get older. So stem cells have a pretty cool way of doing that. One, they can secrete these things called cytokines, these little molecules that actually have the ability to lower inflammation in the body. So they're anti-inflammatory cytokines or anti-inflammatory molecules, things like transforming growth factor beta or interleukin 10. These things naturally lower inflammation in the body. They also downregulate or don't let pro-inflammatory molecules actually get started. So they make it so what would cause inflammation in the body, they turn that switch off basically. And then the other thing that they do is they help modulate the immune system. One of the things that we have to do to make sure that people stay healthy and get healthy again if they're not healthy right now is make sure that our immune system is functioning really, really well. Our immune system is most famous for keeping us not getting sick from bacteria, viruses, pathogens, etc., that are trying to get in, as well as that are already in our body. But our immune system is also constantly on the lookout for cancerous cells or precancerous cells, are these things they call zombie cells or senescent cells, which cause chronic disease and cause chronic inflammation. So if we can have a balanced immune system, not only would we be less likely to get sick, but our immune system can be responsible for causing that chronic inflammation that's the leading killer of mankind. So when we can balance the immune system, give it support, which stem cells do, when you study aging, one of the hallmarks of aging is something called stem cell exhaustion. And they say that we use our stem cells up, we lose them, they become slower, and it leads to something called immunosenescence. Basically, our immune system becomes weaker. So if we can give the immune system things that it needs to be stronger and balanced, so not overreacting like in the cases of autoimmune disease or producing too much chronic inflammation, then people will be healthier. So one, we want to confront aging, right? All the different ways that our body ages. If we can slow that down or even reverse it, then we can have people not get sick or get over a disease that they have. We can also help them improve their health, and then we try to maintain that new level of health. Our goal with every patient is to try to get them to reach their maximum medical improvement. And their maximum medical improvement, once they get there, is as healthy as they can get again, and then lock them there. And we do that by turning back the biological clock. So we age both chronologically, second by second, minute by minute, day by day, just as everybody does on the planet, but we also age differently biologically. So you can be somebody 60 years old, but because of your environment, your lifestyle, diseases, accidents, injuries, you could have a body that at a cellular level, a biological level, it's 75. Somebody who is 60, who's led a good life, eats well, exercises, does all of the things that you teach and preach and have been known for. If you do that, you could also be 60 years old chronologically, but have a body 45. Now, somebody who has a body that's 45 biologically when they're 60 will have the vitality, the life force, the lack of disease than somebody who is 75. So it's very important that we start to turn back the clock. One of the things, as you know, is we always do something called a biological age or a phenotypic age test. So we test people to see how old they are at a cellular level. We put them through our program and we watch them and they watch as their body starts to biologically de-age. And as we see their body biologically de-age, we start to notice that they have more energy, they feel better, less aches and pains, the chronic inflammation goes out of their body, and they start to overcome diseases that they have. And they also, we know, start to prevent diseases from happening. So stem cells can play a vital role in ending or preventing chronic disease by lowering that chronic inflammation, by helping modulate and giving support to the immune system, by actually getting rid of or preventing scar tissue to happen not just on the outside of our bodies, but inside in our organs, as well as help our bodies start to generate. They can actually help the cells in our body basically wake up, also de-age, and start to be able to produce more tissue and cells like they used to. And so there's a lot of different ways that we approach this, but one is let's handle what's causing aging. Let's turn people's age biologically back. Let's lower that chronic inflammation that leads to chronic disease. And we find that the body basically knows how to take care of itself. It just doesn't have the resources that it used to. So if we can give it the resources that it needs, the body has its innate ability to regenerate, repair, and maintain itself.
Well, for years we have seen that many of us have had to go outside of the United States to be able to receive our stem cell therapy. What is the main difference of when we get stem cells outside of the United States and what we actually are able to get within the United States?
Yeah, well, because of regulations, it's still very limited what we're able to do in the States, not only from the products that people can get, the actual tissue or the cells, but even from how they can actually source them or get access to them. So in the States, if you're going to get stem cells or use a tissue product in the States, it's either going to have to come from your own body, right? So either from your bone marrow or your fat, which we used to do, but we've moved away from it once we had this newer technology, or you're going to have to use products that are minimally manipulated. So in the States, they're only basically able to take that Wharton's jelly that we talked about, and they can slice off a half a cc or a cc, and you basically get what you get. So whatever's in there, that's the number of cells that you're going to get. And it can be within a few thousands to a few hundred thousands to maybe only a few million. So it really comes down to, one, the doctors in the States, they don't really have access to the donors themselves. The donors go to a hospital. The hospital says, would you like to donate it? The hospital takes it. They give it to a processor. The processor does their thing. The processor sends it to the lab. The lab does their thing, and then they send it to the doctor. So all of this process, there's all these different steps. So there's all of these different intermediaries in between the patient, the doctor, and the whole process. So there's not as much transparency. Doctors don't really fully understand what they're injecting into the person because they have to take the word of it of the provider who's given it to them. There's not been any really standard protocols on how to check to see if it's there, if they're viable. And so in the States, the number is very limited. They don't know if there's the quality that we can guarantee, like in Costa Rica or Colombia. And really, if you look at it this way, if we're aging because we've overdrawn our account, we're in stem cell exhaustion, we don't have enough stem cells every single month to pay the bills to put the body back together again, and you're If you have a bank account that's $10,000 overdrafted and you put $9,500 into it, you made a big try at it, you're still $500 overdrafted. You're still in the red. When we're in the red in our banks, we get fined. We get non-sufficient funds fees. And then you get another one and then another one. Our body doesn't find us that way. We basically get disease or can't repair from disease or can't recover. And if you leave your bank account overdrafted too long, when it's in the bank will close your account. If you leave your body overdrafted with stem cells too long, you'll end up having chronic disease, which usually is degenerative, so it usually gets worse. And then a lot of times, as you know, the leading cause of death in the world is chronic inflammation and diseases of chronic inflammation. The number of cells that people can get can be very important.
And I can tell you, I felt the difference because I've never had this number of cells. And what I loved about is the fact is, I got to experience the sophistication of the lab. I got to see my cells, the cells that I was getting into my body with my own eyes through the microscope. You gave me a count of how many cells I've never been offered that before by any doctors. Tell me briefly, what is the main things that you recognize that a first-class lab should have when processing or when working with stem cells in order to set them apart and ensure the highest level of effectiveness when the stem cells get into our bodies?
Perfect. So let's just talk about the cells that you got in Costa Rica. So the cells that you got in Costa Rica were never, ever frozen. Not one part of that process were they ever frozen. Now, for us, that was very important, and we spent a lot of time and a lot of money trying to figure out how to have cells that would not be frozen. The other thing about those cells we use something called xeno-free media. If you're going to do a study or a trial, you'd want to use xeno-free media because it's produced in the lab, and media is basically what we feed the cells, right? It's the nutrients that we give them that they need to be able to grow and expand. So xeno-free media is the same every single time, which we want to make sure that we have that quality. The cryopreservation thing's important because when you cryopreserve cells and you reanimate them, they can look similar under a microscope, but when you see what they secrete, what they call the secretome, it doesn't have the ability, and studies show this, to actually do the immunomodulation like we were talking about earlier. It doesn't have the ability to support the immune system in the same way. The other thing that you'll notice if you compare the cells that you had that were fresh and never frozen, using that xeno-free media, is they're going to be smaller. Now, one of the things when you do research online, they're going to say, well, when you get stem cells injected IV, they go to the lungs, which is true. That's the first place they go. And they always say, well, they get hung up in the lungs, which is also true. So the smaller the cells, the easier they are to work their way through the lungs. The other thing is they're more agile. So they act more like a leukocyte or another type of cell that's in our body, and they can get their way through the lungs, which means they can go through the lungs and then go to the rest of the body. So they have the better ability to home or go to all the areas of the body that they need to because of their size and because of their abilities to move through the lungs. They also are more robust, or they're more strong. They can actually fight against the inflammation and the other stuff that's happened in the body for longer, which allows the patient to get more therapy. See, stem cells give their therapy through receiving signals from the body on what it needs, and then responding by producing and secreting exosomes and other things as well, like the secretome. So one of the other factors that's vitally important in chronic disease is their ability to donate the mitochondria, which people call the powerhouse of the cell. Stem cells are the type of stem cells we work with are the only cell known to man that can go and actually donate mitochondria to cells that need it. So we need to make sure that the cells can get to all the different parts of the body. So it's important to ask, have the cells ever been frozen? Do you use xeno-free media, or are you using other products? You'd want to see how many cells they are, and you want them to show that to you. And you also want to ask them, can you show me the difference in the cell sizes? Because the cells should be small, and they should be relatively the same. There just shouldn't be a lot of variabilities in the actual cells. So viability, how many of them are alive? should be in the high 90s, right? Mid 90s to high 90s is where we like to have it. It should be, the count should be there. And you want to make sure that you're getting enough of them to actually make that therapeutic change that you're looking for. And then it's the cell size and the different sizes of the cells that you're going to be receiving. If there's a big differentiation from there's large cells and small cells, that would be a batch of cells that you wouldn't actually want to take.
Well, one of the things that I was very impressed by is that these clinics, actually, you have a relationship with doctors that refer their patients to the clinics. That's how all of these patients come to your clinics. Doctors, especially here in the United States, that recognize the value of stem cell therapy, but maybe they're not able to do it themselves, or perhaps they are in a specialty that they don't really want to be in regenerative medicine, or potentially their scope of practice or their license doesn't allow them to do them the way they would like to here in the United States. All these collaborations that you have with doctors in the United States, tell me a little bit about how do you coordinate with these doctors to integrate stem cell therapy into their practices? Because when I saw that, I was really excited because, I spent the last 35 years in this space and work with thousands of doctors that love stem cells, but they never were able to promote it to their patients. How do you give us that opportunity where now we can refer them to you?
Right. And so as you know, because when you were in the clinic, we actually had 2 providers that came down and we had a patient there with them. So yeah, we actually started Infinity because of the request of doctors saying we need a good place to send people when the number of cells that we can give them aren't enough, or other doctors, like you're saying, that are not doing regenerative medicine that like to be able to. So we came up with a program, and probably 90% of our patients come from doctor recommendations or doctor referrals. We laugh, we kind of say we're the place where doctors go to get stem cells because more than 20% of our patients are actually the doctors themselves. We have doctors that send patients, we have doctors that bring groups of patients down, and doctors bring their family and their friends down as well, and we treat all of them. So we came up with an idea. Stem cells are wonderful. We love stem cells, but Fab, as you know, and as you preach, and as you have been saying for decades, it's also lifestyle. And the things that can be done before the patient gets there and the follow-up that happens after is vitally important. So we have a lot of doctors that just say, listen, I want to recommend this person to you, you take care of them. When a patient gets recommended like that to us, we do pre-stuff with the patient, so pre-procedure protocols, and we do after. But most of our doctors are already caring for this patient. And if they sent them somewhere else, those people are going to actually perform other modalities or therapies on the patients that the doctor could do legally in the States. So our mission is to work with doctors to help them grow their practice and give patients access to care that they may not have. And we do that by supporting what the doctor does with stem cells and working together with them to come up with a pre-treatment program that they can do in the clinic locally where the patient lives. The patient then comes down more prepared, so they have less inflammation in the body. They're eating better. Maybe they've done some detox. There's many different things our doctors do. They come down, they get the cells, they get treated, and they go back to the facility that they were referred from, and they stay the patient there, and they continue with the post-treatment follow-up. Now, since the doctor can legally do what they're doing pre and legally do what they're doing post with their licensure, as well as what's legal in the States, they can actually receive part of the package. So we don't sell stem cells, we sell stem cell packages or care packages. So we actually call them, 10 chronic disease type packages or anti-aging packages. The doctor actually can receive the part for the pre as well as the post, and we only get paid for the actual stem cell treatment and application. So it can actually be it really works great for doctors who don't offer regenerative medicine. Now they can share in the regenerative medicine package, and they can help their patients and derive income. And for doctors who are doing it, that say, well, I have this patient, but they really need 150 or 200 million cells or more, so I'm going to send them to you. But we take the patient, they do the treatment before, they do the treatment after, and they share actually in that whole package. And it works really, really well where they're able to generate income and give patients support as well.
Well, one of the things that I was really excited about is how you educated me as to the importance of the pre. What do I need to do to make sure that my body is as receptive as it can be for these stem cells to actually do great once they get inside of my body? And that's something that I don't think a lot of people are promoting well enough, that there is a process that can help us prepare our bodies for receiving these stem cells. But then you didn't stop there. You actually gave me a whole back-end program of what do I need to do to keep supporting the viability of these stem cells through not only lifestyle changes, but really a lot of understanding of what is it that we're doing on a daily basis that may be aging us and that may be setting us up for potentially a chronic disease in the future. So I really love the fact that it's a turnkey program that is not only a treatment, but it's also a lifestyle program that allows me to really understand how I must be engaged in this process of being healthy. A lot of people just want a quick fix. And I've always said that the things that really make us healthy or unhealthy is the choices that we're making every single day. So correct. When you gave me all those amazing suggestions of what to do before I got there, and more importantly, what to do after I got home, I thought that was something that I really got excited about. So, well, I can't thank you enough for your time. I hope that for those of you that are listening, that this was educational for you. If you have any questions, I will put the link right here where you can contact directly TR. And more importantly, be informed. There is a lot of misconceptions regarding stem cells, not only in the United States, but around the world. And it's important that you understand what it is that they are, what it is that you're receiving, what are the different options out there for you, and realize that if you are considering something like stem cells, not only to reverse and prevent chronic disease, it's important for you to be aware of all the options so that way you can make an informed decision. That's really what I'm encouraging you to do. That's why I wanted to have TR, because I know he's meticulous in this space for so many years, experimenting and trying different things. And after the experience that I had, I'm like, I got to have you on my show. I got to be able to pick your brain and ask you questions so you can educate, my listeners. And I hope that you now can see why stem cells could be one of the best anti-aging, preventative medicine, or ending chronic disease solutions that people need to consider. It's helping millions of people around the world, and it's something that may potentially help you. So get your questions answered, do your research, and make sure you make the best decision that you can make. But more importantly, try it. Try it. This is a safe therapy, and it's something that can actually potentially help you tremendously, like it's helped me and many others. So I will see you on the next show. Thank you so much for joining us, and I appreciate it.
Thank you, Doc. Thank you so much.
To learn more about Dr. Fabrizio Mancini's groundbreaking work, visit www.endingchronicdisease.com and join the movement. Together, we can end the silent epidemic of chronic disease and create a healthier, more vibrant world. Thank you for tuning in. Until next time, be well and stay inspired.